High Country parents. We are so happy to be here today with Dr. Wilson from Appalachian Regional Healthcare System, and he is with AppFamily Medicine. And we are just so grateful that we have Dr. Wilson with us, and he's going to answer a lot of our questions that people have been emailing me that hopefully this will bring a lot of light to the area. Dr. Wilson, what brought you to Boone, North Carolina?
Well, my wife and I are from West North Carolina, and I'm from Bakersville, which is below Avery in Mitchell County. And so when this opportunity arose, I was so excited about it and so happy to be back close to family, but also close to folks that I really genuinely care about and love to help sort of inside and outside of medicine. And so it's just a wonderful fit. So happy to be here.
That's great. Boone is such a great area and just such a great area to raise a family.
It really is. We've already been introduced to that in many ways. We're so thankful for the community.
Yes. Well, we are so happy to, like I said, to have you here. And AppFamily Medicine is fairly new within the Appalachian Regional Healthcare System. And we are so excited because my family was able to move over from App Internal Regional to AppFamily Medicine. The big question out there is, what is AppFamily Medicine and what ages can families go to there?
Yeah, so that first part, so we started back in November of 2019. So that was our App Family birthday around just in 1st of November. So the clinic was started with the family medicine residency program in mind. And so really what App Family Medicine will be is an academic clinic where people who have graduated from medical school are training in their residency so that they become board certified and become board certified family medicine physicians. And the purpose of the residency program, the Boone Family Medicine Residency Program, which is at Family Medicine, this is what our clinic is to hopefully keep folks around. You know, there is a vast need, more than I even knew, prior to coming here and joining ARHS and AppFamily, just a sincere need for primary care throughout the High Country. And I'm just so privileged to be a part of something that is really special. And so in the setting of an academic clinic, both residents who are physicians, along with me and other physicians who will be working alongside residents, we will see patients together. So if you, I said this a lot even as a resident, but when you see a resident, you'll get 2 for 1 because that resident actually will come out and talk with me or talk with Charlie Baker or talk with Molly Benedum or talk with David Brendel. And those are the 4 thus far that are part of this program. And then we'll have others as the program continues to grow. And so you get 2 for 1 when you see a resident, and I've always thought that's a good deal. And then, and obviously, also, I have office hours as well as Dr. Benedum and Dr. Brendel. Dr. Baker does not, and he will not have direct patient hours like he did for so many years in Avery County. But he certainly will be working with residents quite a bit, and we're just so happy to have him. He's really our, I mean, how much can you say about that man? But
yes,
he's really our godfather. Right? He was really helped to start the residency. He was one of the very first folks that was really interested in bringing this to the High Country because he knew, and certainly knows, has an excellent pulse on the needs of this community, as well as the primary care needs that will continue to actually be more and more over these next years. And so the residency program is a great fit here. I think we all are just really excited about it. Now, the second part of your question there, this is an academic family medicine clinic, which means we see all comers and we see everybody. And so that means, in the old family medicine phrases, we see the cradle to the grave. And that's true. And we're very excited about seeing the entire family. And, you know, and we're excited to do that here in Boone and serve this patient population that way. And so, you know, what we offer very genuinely and is, you know, we very well may be a part of your delivery. Say if you were delivering in Watauga Medical Center, I'm currently there from time to time delivering kids, similar to like a midwife is, and working with the Harmony colleagues. So you may see us there, and you may see our residents there. We certainly will be there. And then we are going to have follow-up here in our clinic for our newborn care, and then all the way up until the cradle to the grave, I guess. And so we're seeing everybody, and we're really excited about that. And it is an opportunity for folks, if they would like to establish their family care with us, we're privileged to help them.
This is really huge for Boone, North Carolina, that we're having this type of program come to a rural setting. I'm just so excited to have this opportunity, and that we can have our entire family be at one practice. I mean, that's really big.
It's special that, you know, family medicine in a rural setting is where many, and certainly I feel it's really best fit. And so we really have that opportunity to take care of the whole family. And I think that's what really makes us quite special.
Yes, yes, absolutely. I agree. And another question that has been weighing on my mind and several other parents' minds, I know, when they're in this type of setting, what if your child gets sick after hours? What is the protocol for that?
Yeah, we're on call. We're on call 24/7. And so let's hypothetically say that your child is sick, and sick with, any chronic condition, of any acute condition. Say they were born with a genetic disorder or anything, and we are taking care of all folks. And so say they are to call after hours, and say over the phone, they're being assessed, by a physician over the phone, which is always on call. If they felt they needed to actually go to the emergency room to be further evaluated, or if they can wait tomorrow to be in clinic and we'll get them in. We actually have 2 inpatient pediatricians on our faculty, which is really exciting, and really, again, what sets actually our program apart from many other residency programs. And so what we have the privilege of doing is saying to one of our 2 colleagues over there, they will staff it, both of them 26 weeks a year. They'll also be in our clinic a little bit, and we're quite a bit. So that's wonderful components that make us up as AppFamily Medicine, is we actually have 2 board-certified pediatricians on our faculty, along with this guy named Dr. Baker, who has done this for a long time. And so we would have the privilege of calling them. I don't think this would be separate from any other practice in Boone or the High Country, but we just have the privilege of getting in touch with those folks and saying, hey, just to let you know, there's one of our patients is coming down to the emergency room. This is their medical history. It'll be in the chart already, but just really have a nice warm handoff there to let them know that they're coming on in. And so it's really just, again, it's a special opportunity for our residents. It's a special opportunity for us. And I think it provides exceptional care to our patients with that continuity, both in the inpatient and the outpatient setting.
Yes, and as having a daughter with a rare disease, that just warms my heart and eases my mind. If something was to happen, then you already called ahead. They know in the emergency room that she's coming, what her background is, and that is just very settling for a family member, a mom or dad that's getting up at 3 a.m. in the morning, and it's already confused.
It is. It's even possible that those 2 inpatient pediatricians will have seen them in the outpatient setting, and I can guarantee you that our residents have seen them. And so our family medicine residents, as well as us, will be in the hospital as well. I will be providing primarily adult hospital medicine. That's along with the other faculty here, minus Charlie Baker. He's going to only be doing outpatient medicine, but still very involved. But still yet, yes, we have that inpatient-outpatient continuity. And I think it's very special.
Yes, absolutely. And that leads me to my next question. Are there any subspecialties that the doctors that it's going to be involved in this team, will they be covering any subspecialties?
So the subspecialties that we will depend on are really with our the folks within the High Country who already see pediatric patients and accept them, say ENT physicians, et cetera. But we will just have that opportunity within the subspecialty. We will be delivering primary care, and we'll also have that continuity within the inpatient and outpatient setting. And as much as our hospital does, and I've already rotated in and out of the hospital, and I'm going back here pretty soon, and I really love it. We try to keep things on the mountain, take a lot of pride, take it very seriously to offer that aspect of our care. But if we feel as if you need to be established with a specialist position, we have colleagues who will be, again, not different from other practices in Boone, but we'll make sure that you're connected with the folks you need to be connected to. And then, of course, maybe it's just the case that you need to see that specialist physician down the mountain or however over at Johnson City or at Wake Forest or in a number of these places over in Asheville. Maybe you just need to see them every 6 months, and you can see us every 3 months, and we can provide that continuity of care because, again, in an academic setting, we want to see, as many folks as we can see, and we want to be exposed to this just for good training and also just to provide that service to our patient population. So we're very excited about what we're about to get going here, and we're already open, of course, and seeing patients, but our residents will be here in June. And can't wait to see them.
That's going to be so exciting. We'll definitely welcome them with open arms for sure.
Absolutely, yeah.
And Dr. Wilson, obviously we're in an unprecedented time right now. So many families are at home with little kids every day. And what is your suggestion? What would you if you had to talk with a family member right now, what would you tell them?
Well, for better or for worse, I'm sort of speaking from experience here. Maybe the best person to ask that question to is my wife. She works for the CDC full-time remotely, and we have a 2.5-year-old and a 6-month-old, and so we also are working full-time or whatever. It just we are busy like everybody else with a couple of kids at home, and it is interesting, and it provides its own challenges. And the things, when I've mentioned this to folks that I've seen in the outpatient setting and also in the inpatient setting, really just please follow the CDC guidelines. They're as clear as they can be. The simple things that I tell patients are sanitize your hands, make sure just be aware of your hands, and don't touch your face. We've heard this a number of times already. And unfortunately, and I've said this a number of times as well to folks, I wish that all these precautions that we were making right now were unreasonable. They are entirely reasonable. And so we are trying to keep each other safe. We're caring for each other in this fashion. And the CDC guidelines are the place to start, I believe.
Very well said. I don't think I realized how much I touched my face until all these guidelines came out.
Yeah, and I think that's this is often how even viral illnesses are transmitted. And so it's even just a nice public awareness from that perspective. But we're all in this together and sort of day to day and interested to see what the next day holds.
Yes, absolutely. I think as every family in the country is going to come out stronger from this. We've learned a lot through all of this, and I don't know if we've ever been together 24/7 this much.
Pretty amazing. And we have cherished that time as a family and noted how special it is and attempted to take advantage of that as well. So, but yeah, we're busy 24/7 indeed. Yeah.
Yes, absolutely. Well, Dr. Wilson, this has been great. Very appreciative of your time to help bring the light to Boone of this amazing program that we are going to have the honor of having here. And I'm so excited to get the residents here in June. Are there any final words that you would like to say?
I don't believe so. Certainly come and see us. We hope to offer and will offer exceptional care both in the inpatient and outpatient setting, and excited for the residency program and what the purpose of that is, and taking care of folks in the high country. So thank you for allowing me to be a part of this, and for your willingness to talk with me, and excited to talk with folks about this. And so hopefully come and see us.
Absolutely. And we will have a link in the video description to the website where they can get more information on how to set up an appointment and all the doctors' profiles. And again, thank you so much, Dr. Wilson. This has been great, and I appreciate your time today.
You're welcome. Thank you.